A study shows that unvaccinated people who recovered from COVID-19 face a higher risk of heart complications. The Nanyang Technological University-led study reveals that they are 56% more likely to be at risk. Our complications include heart failure, stroke and blood clots a year after they're infected. The study is the first and largest to examine the risks of long COVID in Southeast Asia. It's based on medical records from over 106,000 Singapore residents diagnosed with COVID-19 between September and November of 2021. More than 900 patients who recovered had lingering after effects, such as fatigue and shortness of breath. Over 300 unvaccinated people developed abnormal heartbeat a year after being infected. Vaccinated survivors and those who got booster shots only had an 11% risk of heart complications as compared to those who were uninfected.
If you're vaccinated or boosted prior to your infection, these risks of heart complications actually go away, and you have no difference in risk compared to someone who is uninfected.
The NTU team says future research will look at respiratory complications and the impact of long COVID on healthcare services. Other strains of the COVID-19 infection could also be examined.
This study was done for patients who are infected during the Delta wave. So it'll be interesting to see whether these complications extend to COVID-19 survivors currently. And in terms of care, clinicians and those who recover from COVID-19 will need to take note that there's an increased risk of heart complications following COVID-19 infection and recovery. So they need to look out for these conditions.
And staying on the COVID situation, infectious diseases experts say the public and private sector must continue working together to keep Singapore protected. The partnership is also crucial in dealing with any future diseases. They're urging people to stay updated with their COVID inoculations as new vaccines roll out. The experts made these observations in a panel discussion organized by pharmaceutical company Pfizer. The panelists say that while vaccination is no longer a requirement, newer vaccines are critical in dealing with the evolving strains of the virus.